Good morning, everyone, and thank you for taking time out of your day to be here. My name is Mallory Madden-Para, and I am one of the care coordinator RNs with Sutter-Roseville Medical Center. Today, I will be sharing with all of you a presentation regarding policies and ethics as they relate to care coordination, specifically within skilled nursing facilities such as this one. This information is vital to educate us on some of the governmental and state policies, as well as ethical considerations when coordinating care between facilities. This will be the agenda that we follow for today's presentation, starting with an overview of care coordination. We will explore some moral and legal considerations that go into care coordination, specifically how they relate to skilled nursing facilities. Then we will examine how government regulations impact care coordination. We will review the Code of Ethics for nurses and the impact that code has on continuation of care. Finally, we will conclude with key ethical and policy issues affecting coordination and continuum of care. A nurse's role in care coordination. According to an article published in the Care Coordination Journal entitled Care Coordination, Agency for Healthcare and Research and Quality, care coordination is key to give our patients efficient and safe care. This involves purposeful planning of patient care activities and relaying the information to appropriate parties involved in the interdisciplinary team. Because a patient's preferences will be voiced in advance, as well as properly communicated with all parties, the patient will receive treatment that is appropriate, safe, and in an efficient manner. The primary objective of care coordination is to accommodate patients' needs and choices while not compromising the highest quality healthcare treatment. Patients' preferences are recognized and endorsed to the proper resources and used to direct the provision of efficient care. Government, state, and local policies effect on coordination of care. Coordination of hospital discharge and admission to a skilled nursing home is usually facilitated by the hospital's case manager and social services of the admitting care facility. There is an additional stage for families in California who want to move their loved ones into certain residential care homes for the elderly. To guarantee that the institution can meet the residents' care needs, a doctor must submit a report outlining those needs. According to California state law, residential care facilities for the elderly must determine that residents meet the institution's specific admission requirements and that the facility can provide the necessary care. The California State Physician's Report, Form 602A, advises a licensed senior residential care facility on a prospective resident's care, medication, help, and other patient needs. California Form 602A for residential care facilities, no date. The ethical dilemma with the 602 form is the potential for false information being reported. Because the information provided determines whether the patient can discharge from the hospital, makes it more likely for patients to be portrayed healthier than they may be. There is potential for error if the nurses are overtasked and they do not fill out properly the information or miss pertinent patient history while completing the forms. Many of you have heard of Obamacare or the Affordable Care Act. This federal law was created in 2009, enacted in 2010, and has three primary goals: to give Americans more affordable health insurance, to innovate the previously broken healthcare system, and to expand Medicaid. According to an article in PLAS Medicine entitled The U.S. Affordable Care Act, Reflections and Directions at the Close of a Decade, the Affordable Care Act, or ACA, improved consumer insurance coverage in several ways. It first established state-level health insurance exchanges based on subscriber coverage options so that consumers could evaluate comparable coverage options and choose from a range of competitive plans. In addition to providing subsidies to eligible low-income individuals and households, the health law also allowed individuals to obtain insurance, even if their income was higher than the federal poverty level. One of the most significant implementations of the ACA was that insurers were forbidden from patient enrollment discrimination based on health status, meaning they could not reject away applicants or charge them more for coverage because of pre-existing medical conditions. This legislation introduced new minimal federal consumer protections. The benefit of this act is that all Americans finally have access to medical care and health insurance. The inclusion of all patients decreases the fragmented healthcare services and it simplifies coordination of care. Health Insurance Portability and Accountability Act, HIPAA. Another important act for nursing home care coordination is the Health Insurance Portability and Accountability Act. The U.S. Department of Health and Human Services was tasked with creating rules and laws to protect the security and patient privacy of health information. Thus, the Health Insurance Portability and Accountability Act was passed into law in 1996. According to Health Insurance Portability and Accountability Act of 1996, HIPAA, CDC 2022. Due to this, HHS established privacy and security guidelines. Before HIPAA, the rapidly developing healthcare system had minimal security or privacy regulations. HIPAA may intentionally appear to complicate care coordination, but it safeguards individual privacy while also involving them more deeply in who receives and shares information and where. As a result, people can take part in the decision-making process for coordinating their care. Nursing practice in the United States is primarily governed by state and territory laws. The Nursing Practice Act is what provides the definitions for these state and territory legislations. The nursing board of each state and territory is given jurisdiction to determine how nursing care is provided. Their role is to enact laws and interpret the NPA into rules. The individual state board of nursing, BON, in each state oversees each state's governing NPA. The Board of Nursing has the responsibility of upholding nursing legislation as they are required to discipline regulatory violations. Boning and Haddad, 2022. The Nursing Code of Ethics has been thought to be created by Florence Nightingale as a part of the Nightingale Pledge. In the 1950s, it was refined by the American Nursing Association and continues to be modified to this day. What is the Nursing Code of Ethics 2023? How many of you are taught in nursing school that nurses are responsible for prompting patient autonomy, upholding justice and beneficence, and the do no harm or non-maleficence phrase? These 4 principles come from the Nursing Code of Ethics. In 2015, provisions were added to help define the nurse's practice, according to what is the Nursing Code of Ethics 2023. The goal always has been that nurses eliminate disparities, aid patients in their health goals, and improve health status. We achieve this goal by communicating between hospitals and discharge facilities, as well as with various physician and varied specialties. By coordinating care, disparities will be reduced and residents' individual care objectives will be achieved. Also, it is notable that the most of the provisions include care coordination. Skilled nursing facilities, ethical and policy issues in coordination of care. Each year, almost 2 million Medicare patients are discharged from hospitals to skilled nursing facilities for further recovery. The process can be rushed with minimal explanation of the plan of care details. Because there are laws and stipulations prohibiting staff to give personal preferences to facilities, oftentimes families are left having to quickly guess which facility is best for their loved one. Studies have shown that because of the disconnect in discharge education and coordination of care, almost 84% of discharged patients could have selected a better facility with higher rated care within a closer proximity to the chosen facility. Graham, 2020. Patients should make decisions in conclusion about their own health without being subjected to undue influence, according to the principles of autonomy and informed consent. Healthcare professionals can then deliver patient-centered care. Additionally, integrating patients in their own care by giving them autonomy for their facility choices fosters therapeutic nurse-patient connections. Varkey, 2021. Patients deserve ethical and thoughtful care coordination, and they need our help to make transitions from hospitals to skilled nursing facilities less complicated. While we learned that there are laws and policies in place to assist with coordination, we must continue to be vigilant as nurses to care for our patients from admission until discharge. Thank you for your time.